It's me, it's you, it's us. It's every single one of us. We're all the same, connected and interdependent, united. What I do today impacts you tomorrow. Just think about what's possible. Providing children with a high-quality education and the necessary supports can change their entire future. One job opportunity can fuel a lifetime of success. Access to affordable health care can increase productivity. And just one helping hand during a crisis can help keep families together. The United Way of the Battle Creek and Kalamazoo region invites you to be part of the change. Together, we can help more children. We can build financial stability in our community. We can ensure that more people have access to health care. And we can help people get their basic needs met. It's time to give, to advocate, to volunteer. It's time to live united. It's time to change the story. You could say high school begins at age 3. Exposure to books before school even starts and entering school ready to learn helps make a young person up to 4 times more likely to finish high school. That's 4 times. The United Way of the Battle Creek and Kalamazoo region supports programs and initiatives aimed at improving access to affordable childcare and early learning opportunities. And we're partnering with parents and schools to improve graduation rates. We're removing obstacles. We're moving the needle. We're making a difference. We're changing the story.
So no great movement in the history of the world has ever happened without collaboration, without people coming together to work on an issue. Well, the same applies to Casey Ready Fours and this issue of high-quality early childhood education.
The research is really clear that learning that occurs from birth to 5, the majority of learning occurs during that time. And so when we have children who are entering kindergarten who may not be at the same level as other children, and so our goal is to close the gap there by enrolling children in a high-quality pre-K program.
Obviously, early childhood education is a critical component of our future. We're not going to be able to have a strategy for growth in business, growth for our community. We're not going to grow socially or culturally unless education is at the heart of that.
Casey Ready Fours is a community effort, and it involves a variety of people from the community. It involves teachers, superintendents. It's very important that it is collaborative and the people work together in order to provide kindergarten readiness among children.
But to see that the community come together to invest in this and to work on it and to make it happen was, I mean, it was a dream come true, really. I've been doing early childhood for over 30 years, and I've been waiting for the day that this happened. Honestly, it makes me teary-eyed that it is.
It is built on the spirit of collaboration. The United Way has been instrumental. I don't think without the United Way, I don't think we'd be where we are today. Their willingness to step forward and appreciate and understand the importance of providing high-quality pre-kindergarten for children.
Education is what levels the field. Education is what frees people to be who they're destined to be on this earth. Education is the tool that frees people to have permission to be successful. And that's what we want for every 4-year-old in this county. That's the kind of future we want. That's the kind of movement we want to create, is freedom to fly. Who wouldn't want to be involved with that?
When you're living from paycheck to paycheck, what happens when your car breaks down? When a family member gets sick? When you lose your job? preparing a career-ready workforce, ensuring that people are financially literate, and individuals and families have safe and affordable housing benefits us all. The United Way of the Battle Creek and Kalamazoo region continues to support programs and initiatives that teach residents to budget and save, that prevent homelessness, and that assist in preparing taxes for qualified individuals and families. We're removing obstacles. We're moving the needle. We're making a difference. We're changing the story.
I'm Sita Bell, and I live united.
I'm Robert Leiter, and I live united.
Me llamo Luis Enriquez, y yo vivo unido.
I'm Galen Barnum, and I live united.
Well, the eviction diversion program is a unique program that involves the Department of Human Services working very closely with housing resources. And the goal of the program is to prevent families from becoming homeless.
One of the most important parts of the eviction diversion project is it is truly a community collaborative. A number of partnering agencies are working efficiently together to try to resolve evictions early in the court process, as well as to provide family stabilization services.
It's to keep families together, to keep kids in one school, so they're not jumping around school. That domino effect, you could see that happening. They're pulled from this department, they're in one school district, and then the next, and the next, and the kids, they're going to start failing at school.
Many of the families that are asking for eviction assistance to try to prevent an eviction are folks like you and me that have been downsized from an employer, who have an unemployment situation, or who have faced a crisis medical situation and it's negatively affected their income. In these times of dwindling resources, it's more important than ever that we make use of every dollar that we're given through public and private resources, as well as help provide as many services as possible that a family or an individual may need.
It's great that they've all come together. It's great that they've been able to come up with this financial program so that it's there for people who want to take advantage of it.
United Way has been an integral partner in the eviction diversion project. And they really do walk the walk and talk the talk regarding being involved in making a difference in people's lives.
When you don't have access to adequate health care, you may not be able to afford the prescriptions and/or medical attention that you need. Your health may suffer, and as a result, you may not be able to work, which is necessary to pay your bills. Ensuring that community members have access to quality and affordable health care in our community benefits us all. The United Way of the Battle Creek and Kalamazoo region continues to support programs and initiatives that are increasing access to critical healthcare services and increasing health education and preventative care. We're removing obstacles. We're moving the needle. Together we're making a difference. We're changing the story.
I'm Emily Clark, and I live united.
Live united.
Live united. Live united.
That's right. Live united.
One of the things that's important to me for people to understand about the United Way is it's not just that the United Way raises funds from all of us in the community. The United Way has some very key investments in knowledgeable staff that really understand public policy.
The nurse-family partnership is important because not everybody in our society has the same access to resource that allows them to have good outcomes either in pregnancies or in births or in their life course as they welcome a new baby into the family.
The nurse-family partnership is an evidence-based program that uses skilled nurses, RNs, to make home visits to first-time moms before they give birth. They work with the mother according to a protocol, helping to educate her around health issues in terms of her health, the baby's health, working with them to end any use of substances that they might use that are going to be problematic for the baby's health. And then as things move on in the pregnancy, they're moving toward starting to think about the baby's development while they're in utero and then after the birth, teaching the mom about key developmental milestones. And the really important things too, I think, are about helping her understand the importance of that bond for the baby's security, for the baby's emotional development.
What's important about nurse-family partnership is what we're addressing is infant mortality issues and disparities in infant mortality issues. And those health disparities, in other words, black babies die at 3 to 4 times the rate of white babies, has to do with the way our societies and systems are set up. And so we do have to come together as an education sector, as an employment sector, as a housing sector, and start to address the systems and the structures and the policies that are the way we build our community in order to ultimately affect health outcomes that are not necessarily the same for some people as they are for others.
You see the outcomes in terms of school readiness later on, helping with that sort of that internal emotional control that's critical to school success and later to work success. And the moms are helped by that nurse once they're stabilized in the baby's development to think about their dream.
So it's a program that supports people who are at a different place in life, maybe at some sort of a disadvantage, who have a high risk for a poor pregnancy outcome, and works not only to make that pregnancy outcome a good outcome, but works with the family in terms of self-sufficiency and education and all of the things that surround being able to bring that baby up and to create a family unit that is healthy in terms of their mental health, their social well-being, as well as what we consider a traditional health outcome.
The United Way of the Battle Creek and Kalamazoo region is committed to helping families and individuals meet their basic needs. We can change the story. We are changing the story. So why help? Why should you help? Because the cost of doing nothing is too high. It costs us our children, our financial well-being, our health, and our community. But doing something, now that's magic. Because what I give comes back to me, to you, to us, time and time again. When our children succeed, we all succeed. When our neighbors meet their basic needs, we all win. That's why United Way is focused on education, income, and health, the building blocks for a good quality of life. Please join us. It's time to give, to advocate, to volunteer. It's time to live united.